Hello everybody. This is Dr. Arul Amudan from Manipal Academy of Higher Education. Today I am going to talk an important topic about the Siddha Supportive Integrative Oncology Care. Today the World Cancer Day. World Health Organization has classified the diseases into the International Classification of Diseases. Traditional Siddha medicine literatures classified the human diseases as 4,448 types. This is the only traditional medical system that classified the human diseases and has given the specific treatments along with the symptoms. When we look at the cancer, it is not a new disease. Even the traditional Siddha medicine literature described the cancer in various names. They used the term called Putru. This type of structure, this is called termite mound. If you destroy this material, the top one, that is termite mound, it will again be rebuilt and it will have its own underground tunnels and it will spread to nearby places, so that within a short period you can see multiple termite mounds in a particular geographical area. Irrespective of hot climate or cool climate or rainy outside the termite mound, inside it maintains a micro environment that is essential for its own survival and multiplication. The symptoms of cancer, including the overgrowth, it cannot be completely destroyable. It will spread to nearby places, which is called as a metastasis, and it has its own metabolic pathway, which is unusual than the normal cells. Characteristic features are very much similar to the termite mound activity or behavior. Hence, the ancient Indian yogis called Siddhas named this cancer as a disease like termite mound. Kadalai, it's a movable mass. Katti is the immovable mass. And also horn type of overgrowths. Parangi, Girandi are the irregular shaped small growths. Lymphoma, lymph node related cancers are given name as Arayapukatti, Todaivale, Kandamale. The first ancient traditional literature on cancer, Putru Nidanam, which deals the oncology, and that described the 18 types of cancer which were seen in those days. Marbaka Marthu means medicine for breast disease. So it described 8 type of diseases which is seen in the breast, like cyst. It also clearly describes the disease progression. It's how it starts, it spreads to lymphatic channel, and later how the ulcer forms and all, with along with some medications. Among the all the traditional medicines available in the world wide, only traditional Siddha medicine has a deeper understanding about the cancer. Further, the Siddha literature talks about organ specific cancers. For example, the buccal cancer is called as a kanna puttu, because kannam means the buccal in Tamil. Similarly, tongue cancer, naku puttu, carcinoma cervix, yoni puttu, liver cancer, ஈரல் புற்று, வெள்ளீரல் புற்று is lung cancer, வேர்பாறு, தலைபாறு, மிஞ்சின கால், மெல்ல மெல்ல பற்பம் செந்தூரம் பாரு. Treat with the roots and shoots. If not responding, gradually administer mineral drugs. Mineral drugs mean metal-based drugs like mercury, arsenic. Based on my research in the pharmacology field and my experience of interacting with many traditional Siddha Vaidyas and Siddha doctors who practices oncology, I have categorized the Siddha supportive care into 5 categories. Category 1 drugs are equivalent to chemotherapy. They are called Siddha chemotherapy drugs. These chemotherapy drugs are nanoparticles prepared from the gold, arsenic, sulfur, mercury, copper. So they have the equal property of killing the cancer cells as well as normal cells. So usually Siddha chemotherapy drugs are given for a short period. For example, 3 days, 5 days, 7 days, 15 days. After that, some drug-free holidays are given along with some dietary restriction and some herbal treatment to reduce the adverse effect during the therapy. Again, the cycle is continued, drug therapy is continued. This is how the cyclic chemotherapy at higher doses are given in Siddha medicine. Category 2 drugs are called broad spectrum drugs. These are usually herbo-mineral. It will have both herbal as well as metallic components. So this is how it is slightly safer than the category 1 drugs. They are used as a maintenance therapy and they can be given for a longer period. So these drugs are having immunomodulatory and have the property of prevention of metastasis. It is nothing but the herbal supplements. It is for the general well-being, to treat symptoms, to strengthen the organ that is affected by the cancer. For example, if the lung is affected by the cancer, so we have specific herbals to strengthen the lung. to rejuvenate the lung. Turmeric, Amukaras, Ashwagandha, and there are many Kayakalpa herbals. Category 4 drugs are used to alleviate the adverse effect of chemotherapy or radiation therapy. These category 4 drugs are used to alleviate the adverse effect of Siddha chemotherapy drugs. And today we are using the same herbal to alleviate the adverse effect of chemotherapy and radiation therapy. Category 5 is actually Siddha palliative care. So here the Varma therapy, which is the unique therapy of Siddha medicine for the pain management by pressure and massage therapy. I want to emphasize here that yoga, pranayama and meditation are the therapeutic modules developed by the Siddhas. So which is the part of traditional Siddha medicine. When the patient come to Siddha for the cancer treatment, we prepare the patient by giving simple detox methods. If the patient had already undergone surgery or chemotherapy or radiation, then we give only low dose of Siddha chemotherapy category 1, or we straight away start category 2 herbomineral drugs. Old age patient or patient refuses the usage of chemo, radiation or surgery, or the patient is not fit for the surgery, then we will straight away start the Siddha chemotherapy drugs, followed by category 2 drugs. Patient who already taking chemotherapy or radiation, we can combine as an add-on therapy the category 3 herbal supplements as an adjuvant. After completing chemo radiation therapy, if any adverse effects are observed, then we can use category 4 drugs to alleviate the adverse effects. So this is how Siddha can be integrated in the cancer care at various levels. Whatever I had here have been already tested by Dr. late C.P. Mathew, who was the oncologist at Kottayam Medical College, Kerala. Pioneer in India for Siddha Integrative Oncology. Nearly 35 years he practiced that until his 92 age. When he was 91, I met him at his hospital at Kottayam. I stayed there 10 days. Dr. C.P. Mathew shared all the medical records, how he treated. With that, I was impressed and I am continuing that kind of integrative care even now also. From his word, Siddha is a divine medical system which can be safely integrated with the allopathic treatment. Siddha drugs are immunomodulators that allow reducing the chemotherapy dose. So we can reduce the toxicity or adverse effect of chemotherapy after intensive treatment by allopathic system like chemo, radiation or surgery. Siddha is very much useful for the maintenance. By combining Siddha at various level, the patient quality of life can be improved. That is what his entire life observation. United States and other developed countries, oncology hospitals and medical centers, they have the integrative medicine. They realized that the current advanced modern medicine is not sufficient to cure the cancer. So they are slowly integrating many things like diet therapy, turmeric therapy, hormone therapy, even psycho-oncology, music therapy, yoga, massage, traditional Chinese medicine, acupuncture. They are looking for alternative therapies. If at all some hope is there, they are ready to adapt it. I request the government of Tamil Nadu and government of India to include traditional Siddha medicine wing in every cancer hospitals, in every medical colleges, in every specialty cancer centers. The integration of Siddha allopathy has already started at the patient level. And in Manipal, we are doing under the Center for Integrative Medicine, we have started the integrative approach. Thank you very much.